The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. This is Jennifer Lisanti, the Director of Sales at Beere&Purves. Thank you very much for participating in today's webinar. We know it's an extremely busy time in our industry. This is our annual Medical Portfolio Refresh webinar for 2019. And a couple of housekeeping items before we get started. First, we will be sending out a copy of this presentation to all attendees. And everyone is currently on mute, but we love questions. There's a lot of content in this presentation, so it probably will go the full hour. We'll check for some questions at the end, but if we don't get to it, we'll certainly respond back to you after today's webinar. And having said all that, we'll go ahead and dive into the information. So these are the topics we're going to start covering today. So first, plan and network offerings, benefit information by carrier, pharmacy info, network, underwriting, rates, and commissions. So the first topic is Aetna, and we're going to talk about the plan offerings that they have. I'm not going to speak to every bullet point. I'm going to focus more on what's in bold, but you'll have this as a reference point for later. So with Aetna, they've had in the state of California something they call an MC plan. That technically is a national managed choice point of service in the rest of the nation. But in California, for small group 1-100, it functions like our California PPO plan, and that is continuing on for 2019. So when you want to sell, quote unquote, a PPO with Aetna, it'll be called a managed choice MC plan. No primary care physician is required on that because it functions like a PPO here. The third bullet point you'll see with HMO, this is actually not new, it started in 2018, but a reminder that when you sell Aetna, if you're looking for a full network HMO, they only have one plan design, which you see listed there. What is brand new for 2019 is the fourth bullet point, actually, I'm sorry, the fifth, and what's going to be brand new is they have had a true PPO plan design for California, but we didn't sell it much because we were selling that managed choice point of service as our California PPO and small group. However, out-of-state employees, if there's not a managed choice point of service network, they were enrolled in that PPO plan. In 2019, Aetna will no longer sell that true PPO plan. So what that means to you, so more so if you have any Aetna in-force groups with out-of-state employees, please keep in the back of your head that you need to look to see if those out-of-state employees live in a managed choice network area. If they do not, unfortunately, they will no longer be eligible for an Aetna medical plan and we'll need to find a plan B for them. Probably at that point, you'd be looking at United Healthcare or possibly Covered California as well. And then we just listed at the bottom here, the top selling plan for 2018 with Aetna was the Bronze MC plan. Aetna had some changes in 2018 as far as what they were doing here in the state of California, but ironically, we actually sold more in 2018 than we did in 2017 with Aetna in particular. So, and you'll see if you haven't seen it already on your spreadsheets that Aetna is a very viable option for the Bronze 6000 HSA plan in 2019. Moving on to Anthem, so they still have PPO and HSA plans. One thing I want to point out with the HSA, and this affects large group and small group Anthem, is they are rolling out a brand new HSA vendor. The name of the vendor is called ActWise, and at the group's anniversary date, about 90 days in advance, they're going to be notified that they have the opportunity to move from Benefit Wallet to ActWise. They don't have to do it, it's not a forced migration. If they stay with Benefit Wallet, there will be higher admin fees because there's no longer the integration with Anthem and Benefit Wallet. If they want to move to ActWise, then there's going to be a lot of nice integration at the employer and member level. But you do have to transfer, those HSA accounts from Benefit Wallet to ActWise. So there's some forms required at both the employer and employee level. We can dive more into that. If you have questions, just contact us. What's new for Anthem in 2019 is they're rolling out an HMO plan that's a copay plan, not a deductible HMO plan, which is a nice feature. And they're also rolling out in 2019 a brand new Anthem EPO in small group in California. What's unusual about this EPO plan is it is using the Prudent Buyer PPO network that's very large, that we're all very familiar with. There's just no out-of-network coverage because it is an EPO plan. They are encouraging members to select PCPs, but PCPs and referrals are not required on this new EPO plan. So just be aware, they can put it down on their application and Anthem will reach out and request one, but they don't have to use that PCP. Just trying to encourage people. I think we all do better since we're not in the medical field with someone help navigating our medical care. The other item on the EPO to be aware of is the medical deductible applies to RX tiers 2 and 3. So you will see this new EPO offering with Anthem and California Direct Small Group. So beware of those features. The price point really isn't there yet, so I'm not sure if you'll sell too much of it, but you will start seeing it on your spreadsheets. And then we list there the top selling plans for Anthem in 2018. We tend to sell higher end Platinum and Gold full network PPO plans with Anthem. CalChoice. So you can see not a lot of changes there. They have still Anthem for the PPO. They have Anthem's EPO as well. You could go down the list. What I really want to point out with California Choice is starting December 2018, they have a brand new carrier, which is Oscar Health, which is getting a lot of press. It is in Orange County and Los Angeles, so it's not in the Bay Area or San Diego yet, for example. But it's a brand new insurance company. There's a lot of VC funding behind it, and the concept is what can we do to make or solve the problem with the medical world? And it's engaging members. There's going to be like a concierge service to help people navigate through the complicated medical system, etc. So Oscar Health is brand new within CalChoice, effective December 2018. But it's only located right now in Orange County and LA. They are looking to expand in additional areas. And then a reminder with California Choice, just like in 2018, in 2019, it's great news that the Kaiser rates direct and the Kaiser rates through CalChoice will be identical. Same with Sutter Plus and Western Health Advantage. So if it's the same plan as you can buy outside, the rates will be identical with Kaiser direct through CalChoice. And then we will always sell our top selling plans with CalChoice. Kaiser's always up there, of course. So the Kaiser Platinum A and Silver B, and then the Anthem Gold PPO A for 2018. CCSB, if you're not familiar with it, that is the old shop. It stands for Covered California Small Business. So we're very excited at Beere&Purves because we started a contract with CCSB in October of 2018. And for the fourth quarter, they have quickly become our second top selling medical carrier. So the huge attraction to CCSB is the fact that you do have a true full network PPO with both Blue Shield and Health Net. So again, Covered California has true full network PPOs with Blue Shield and Health Net. The Blue Shield Trio ACO HMO plan is also very popular. It's got some very nice providers in there, and CCSB has the Blue Shield Trio HMO as well as Kaiser, of course. What is very unique with Covered California Small Business is the fact that the rates with Kaiser are actually better than if you were to buy Kaiser Direct. And the reason is the Kaiser plans through CCSB do not cover pediatric dental. And so it costs less than if you were to buy Kaiser Direct because it does include ped dental outside of CCSB. And just a quick note, you cannot add pediatric dental onto the CCSB Kaiser plans. And our top selling plan currently with CCSB is a Kaiser Gold. HealthNet, no changes in the plan offerings that they have, still PPO, HSA, HMO, their community care, which is very popular in Southern California, LA and Orange counties, and the HSP plan that's been around for a while but hasn't gained a lot of traction. We are selling some HealthNets, but the top selling plan, they're going back to being what we've always known them to be really, which is a narrow network HMO carrier in Southern California for the most part. So you'll see the top selling plan we have is a Smart Care HMO. It's a narrow network in Southern California. United Healthcare, also no changes to their plan offerings. You see them listed there. The top selling plans with UHC are PPO as well, but it's more gold and silver levels than platinum and gold with Anthem. Moving on to what plan and networks can you offer at the same time? This gets very confusing. We get lots of questions on this. With Aetna, they don't care which network you put together, full and narrow HMO or PPO, and any metallic tier. They just require that you pick a maximum of 5 plans. What you'll probably be selling if you're selling Aetna in 2019 is that 6,000 HSA bronze plan, But they highly recommend when you're enrolling the group, throw on some other plan options just in case you need it for new hires down the road or to give that group flexibility down the road. But again, 5 plans with Aetna, full and narrow is allowed, and any metallic tier. Similar, Anthem doesn't have, different portfolios. They just have one plan offer or one portfolio per se. It's their employee elect that they've had for years. They do restrict networks that you can sell side by side. They allow 2 HMO networks, and this is a promo that they've had for actually a couple of years now, continuing into 2019, but they do not allow 2 PPO networks, so keep that in the back of your mind. But they don't care about the metallic level, so you can put platinum with bronze if you'd like. Which leaves us, the biggest change in 2019 is California Choice. They used to require 2 adjacent tiers. In 2019, California Choice will now allow 3 adjacent tiers. The caveat is they won't allow bronze being one of the 3 adjacent tiers. So that means you can now sell platinum, gold, and silver all together with California Choice starting January 2018, which we're very excited about because we would often get brokers that wanted to sell the platinum with the silver levels. Covered California small business, no change at this point for them. They still allow the 2 adjacent tiers, so silver and bronze or platinum and gold, but you couldn't put the platinum with the bronze. So no change for CCSB in 2019. HealthNet. HealthNet's changed their portfolio offerings very recently, and this is what we have for 2019. We're back to 2 portfolios offered with HealthNet. There's the Enhanced Choice A and Enhanced Choice B. To make it very simple, if you're Northern California, you'll probably sell the Enhanced Choice A. It's Northern California focused because that's where you're going to find the full network PPO plans that tend to sell in Northern California. But if you're in Southern California, rather your group's in Southern California, please keep in mind that Enhanced Choice B is Southern California focused, and that's what opens up all the narrow network HMOs, but you no longer get the full network PPOs. You only get the full network bronze PPO. But it's a great option for Southern California groups and brokers. United Healthcare. So United Healthcare in 2019, they've played with their portfolio offerings again, and you see here on the screen that there are 4 different Choice Simplified portfolio offerings now in 2019, in addition to the multi-choice state offering. So that really brings to 5 offerings, and in April of 2019, I believe there will be 6 offerings. So let's just focus on what we have for the first quarter of 2019. You see there's Choice Simplified 1, 2, 3, and 4. To break it down for you, if you or your group is in Southern California, you'll be focusing on this Choice Simplified 1, and the reason is it includes all the HMO networks, including the best of the best HMO plan. What you don't get with the Choice Simplified 1 portfolio is the best platinum PPO plan. UHC has 2 platinum PPO plans, you just don't get the richest platinum PPO plan offering. Choice Simplified 2 is very close to Choice Simplified 1, it just excludes Alliance. And then Choice Simplified 3 is what Northern California groups are going to want because that includes all the PPO offerings, including the richest PPO plan. Now, unfortunately, in 2019, you can no longer get the best HMO and the best PPO platinum plans together in the exact same portfolio. So you really need to look at the group and figure out, are they more HMO dominant or PPO dominant, and then that's going to choose your portfolio. But we're here to help you, and that UHC portfolio selection page, I think, is really the easiest way to keep it all straight, so we can provide that to you if you don't have it. The last portfolio is called something different. It's been around for a couple of years, but it does get lots of questions, and that is the multi-choice state portfolio. With that, it includes all the networks, but not as many offerings within each network availability. Initially, that only included the Covered California mirrored required plans that the carriers have to offer, even though they don't participate in the state exchange, and they just set it alongside this portfolio. However, through the years, they've added different plans to it. So now there's more offerings. It's not just the mirrored state plans. So be aware of that. You might sell it more than you would in the past. There are different underwriting rules alongside Kaiser with that portfolio, which we'll touch on later. And one thing, because we've been selling a lot of United Healthcare the past 2 years in small group, it was our #1 carrier, is the fact when your groups are renewing, You do have to keep in mind that when they get their mapped plan, they're going to be showing that they're moving from Plan A to Plan B as a mapped plan. And then you need to look to which portfolio that new Plan B is in to make sure that you enroll them in the right portfolio, because the map plan might not be into the existing portfolio that they enrolled in a year ago. So they're trying to come out with a better tool to help people keep that straight. But again, Beere&Purves is here to help you walk you through all that. Moving on to benefits. This is just a quick one page by carrier explaining kind of some highlights with the benefits. So all the carriers now have Teladoc and Heal house calls where the doctor will come to your house. So no real change with Aetna. They have Teladoc, you pay a certain copay per visit, and they have Heal, which is also a copay, or if you're an HSA plan, it's $109 is the cost with Aetna members. Moving on to Anthem. Several changes there for 2019. The great news is they too have telemed, and that's live health online that they've had for several years. What's nice is they're going to give all members the first 3 visits for live health online free, unless you're an HSA member, because they can't do that. They have to charge the cost of the office visit per se. So just be aware, first 3 visits with live health online, the telemed through Anthem, are now free in 2019. They too have Heal, as I mentioned. If you look at the 4th bullet point, there's a big change as far as what deductibles all their PPO plans have for out-of-network coverage. And we're getting lots of questions because it looks like a mistake. So for example, if you're looking at the 0 or 250 PPO in-network deductible, the out-of-network deductible on all the PPO plans is a minimum of $2,000. That's not a typo. So definitely a message is being sent there to stay in network. You have a much lower deductible. Out-of-network would be $2,000. So just be aware that is brand new for 2019. One item that's not necessarily new within the special offers portfolio discount program, but something that wasn't talked about before, so we're reminding because infertility does come up a lot, and that is they have a discount program through a company called Win Fertility, through the special offers discount program that all Anthem members get. And that can get you 10 to 40% off infertility services. So that's just a great program versus having us pay the infertility rider, which is $90 per employee per month for every employee in the group. And the last thing with Anthem is the Pay Forward program that they have had for a while, but they've added a lot more retailers. And what this is just as Anthem members go shopping, if they sign up, they'll get up to 15% cash back for spending their money. So not a bad program. California Choice, nothing new there. I just want to remind people because with California Choice, there's a lot of added benefits to being a member in a group with Cal Choice, and that's the business suite solutions. Depending on the size group, they give different services for free. So free pop plan, potentially Cobra, etc., depending on the size group. And in 2018, they did add up to 40% discounts on products like Fitbit, Jawbone, etc. CCSB, which again is Shop or Covered California, has 2 niches that no one else has, and that is the tax credit through ACA. I guess there's a lot of confusion. Some people were thinking you could not buy the CCSB group insurance unless you qualify for the tax credit, but that's not true. It's just a possibility. The only way if you can get the tax credit is by being a CCSB group, but you don't have to qualify for the tax credit in order to enroll with CCSB. However, I know a lot of us were kind of discounting that tax credit. We're like, who's going to qualify of people that are offering benefits based on the salary restrictions? However, there's a lot of, say, 2 life groups. Say there's an attorney and he has 1 staff person. For certain owners, you discount the owner and don't look at their income. You just look at the 1 staff person, and that person might qualify, and then you can get that group a tax credit for 2 years. So keep that in mind. And then the second bullet point there, definitely a big niche for Covered California small business that might be help with prospecting, is they are the only carrier that has filed plans to offer employee-only coverage. So with ACA, groups of 50 or more have to offer dependent coverage. The groups under 50 don't. And so this would be a niche where you get that in that catch-22, where technically you're offered affordable coverage through your employer, and therefore your dependents are knocked out of the availability going to the individual exchange and qualifying for a tax credit. So if the group under 50 enrolled through Covered California and they only offered employee-only coverage, then those dependents, that really that contribution by the employer isn't technically affordable in their real day-to-day lives, they could still then go get an individual exchange subsidy, which would be great for those dependents. The only caveat to that is employee-only coverage means just that. It applies to everyone, including the owners of the company couldn't put their spouses and kids on a CCSB group plan if it's an employee-only contract. Health Net, a couple exciting things there, or the number one thing listed there is they were last to the game on Teladoc, but they do have Teladoc now on all HMO and PPO plans, and what's nice is it's always free to non-HSA members. So you never pay for Teladoc through Health Net in 2019. The only other thing, it's actually not new, but I'll point out on this slide, is there are certain plans listed there, the Community Care Bronze HMO, Value PPO, Enhanced Care PPO. You'll see there's an integrated medical and RX deductible, similar to how an HSA plan works. And that deductible actually applies to all services, medical and RX, except primary care doctor visits. So, for example, if you're going to go see a specialist, the medical deductible applies. So just want to point that out because it's different, unique on just those offerings through Health Net. United Healthcare, sorry, this is a little smaller font, but there's a lot of good news with UHC. They too have telehealth like everyone else, as I mentioned, but they have different copays based on the plan you're enrolled in. They have Heal, etc. I want to remind people about the fourth bullet point, the ACEC Engineering and the new NRA National Restaurant and Hospitality Trust. This is a great way, again, for prospecting. If you're out there, you can get composite rates down to a 2-life group if the group qualifies for these associations. So as long as they're members, they can get composite rates down to 2 lives, and the rates are very competitive because they're not California rates. They're actually written out of the state of Illinois. So please keep in that in the back of your mind. We've written a lot of the ACEC engineering, and it's done very well. The NRA is newer, so we haven't written any of that. And there are different caveats alongside Kaiser with those offerings, so just give us a call. Now I want to skip down towards the bottom of the slide. The third bullet from the bottom is the fitness reimbursement. UHC's had this for several years. It's very popular. So if you go to certain places, certain gyms, and you work out as an adult, the employee and the spouse can both do this. Go to the gym 12 times a month, work out. UHC will actually give you $20 a month cash for working out. What's new in 2019 is it's now app-based, which is making it open to a lot more gyms that qualify for this program. It's easier to check in as a member, and you're going to get that $20 per month faster than the program used to work. It used to take about 2 months rather for that $20 to hit your account, and now it's going to be hitting your account faster. So that's a great program that gets a lot of popularity, or a lot of people that like it. What is new for 2019 is UHC has had this in large group, now they're bringing it to California small group, is a program called Motion. It is only for HSA members, but it's a great way to knock down that HSA medical deductible. So first of all, they help the member get a fitness device like a Fitbit, an Apple Watch, etc. So they will give the member a Fitbit, or they can buy up to additional devices if they want to, like I said, an Apple Watch at a discount. If they already have a device, they would get a $55 credit towards their HSA account for UHC not having to buy the device because they already had one. Now, the adult members, the employee and spouse, can qualify to earn up to $3 a day for certain fitness programs. So one is, you hit 10,000 steps a day, you earn $1. Another one is duration of how often you're walking and frequency. So up to $3 a day, which, that can put almost $1,100 into that HSA account to knock down that HSA deductible. So it's definitely a nice feature, and they've had that in large group, and it's very popular. All right, now we're switching the conversation to pharmacy. Nothing new with Aetna, just listing there what their formulary is and their mail order. Want to spend a little time with Anthem. They are not switching to a different formulary. All their small group Anthem plans still use the Select formulary, which is smaller than the formulary they used to have. But we like to remind everyone that Anthem is very flexible. If the member really needs a drug that is not on the Anthem Select small group formulary, as long as their doctor reaches out to Anthem directly, they've had a great success rate at getting those approved. It can't be the owner's wife calling and demanding the drug. It has to be the owner's wife's doctor. But as long as the doctor contacts Anthem, a very high success rate of getting those approved, unlike other carriers that we're aware of. What is brand new for Anthem large group and small group is, if you haven't heard already, all Anthem members are going to be getting new ID cards. The majority of the members will be getting new ID cards at the renewal date, which makes sense. But the reason is they're switching their PBM. So they're bringing it in-house to help. As we all know, the drug costs are kind of out of control, to see if they can help with that. And as a result, there's going to be new RX BIN and PCN numbers, which are the numbers that pharmacies use to process the RX claims when the member gets a prescription. So you see what the BIN and PCN number are listed there. And just be aware, as a result of this new PBM, these new RX BIN and PCN numbers, all members will be getting new ID cards. It's already started happening, so we're already getting questions. New groups got these on their initial ID cards, so they're all set starting in October. However, groups renewing November through April will get these new ID cards at the renewal date, which makes sense. What we want to point out is groups from May to October will be getting these new ID cards off their renewal date, and they'll be receiving them in the first quarter of 2019. So you may get calls from members saying, I'm at the pharmacy and I can't get my prescription drug. And the first thing to ask is, what ID card are you using? Are you using the one in the mail that you didn't realize you had that's sitting at home, or using the one you've been using? So that would be the first thing I would say if you were to get those calls, and to prompt members to use their new ID card. But there are the numbers if you need it. And then the last thing I'll point out on this slide with Anthem in particular is, they did this a while ago, but I think it's a nice feature. If you do go to the retail pharmacy now, you can get a 90-day supply of prescription drugs. It just helps those members save money and time, because they don't have to go every month to get their refill. They're still paying for a 90-day supply, so you're not getting a discount like you do through a true mail order program, because you did go to the retail pharmacy, but it just saves some time. All right, moving on to HealthNet. No change, but a reminder with HealthNet. They do have, they're the only carrier that I'm aware of that actually has two pharmacy network systems. They have their main pharmacy system, which pretty much includes everyone. And then for tailored plans like Community Care, Salud Mas, Smart Care, Enhanced Care PPO, they're going to use a different pharmacy network. And the big difference is it excludes Walgreens. So just a reminder, if you're selling those plans, to remind those members they cannot go to Walgreens for their pharmacies. Moving on to United Healthcare, just a reminder, they're the one carrier that we work with that actually has two different formularies based on which plan the member's enrolling in. PPO uses one formulary, HMO uses another. Unfortunately, it is extremely difficult to get approvals by UHC off that PPO formulary list. It's a very long formulary if you look at it, but if the drug that the member wants is not listed on the PPO formulary, there is no exception for them to get that prescription. So you always want to do that full disclosure ahead of time versus after you've moved them to UHC and then they find out they can't get that prescription no matter if the doctor calls. However, the HMO formulary is just kind of their listing of the top most prescribed drugs. As a result, if you don't see the drug they need on the HMO formulary, give Beere&Purves a call. We'll find out if it is on their formulary. You just don't see it because it's not a common drug that's prescribed. So just be aware of that. Moving on to network information. I'm not going to walk through all this. We're just listing all the different types of networks within the plan structures that each carrier lists and some doctor counts. What I'll point out with Aetna is they've had a Savings Plus Managed Choice network, and they're going to continue to have that in Southern California, but they're no longer having that in Northern California starting in 2019. I don't think there's a lot of membership there, so probably not a big factor for you, but just a reminder. And then moving on to the next slide, which is Anthem. Again, we've already talked about they're introducing that EPO with Anthem Small Group in 2019. It will use the full Prudent Buyer network in California. And when those California employees on the EPO plan are traveling throughout the US, they have the full Blue Card program to use. California Choice, a lot of information listed there. I'll just point out again that they are introducing Oscar Health, and that's in Los Angeles and Orange counties. And then CalChoice did introduce UHC's Advantage HMO network in 2019, so that's brand new. Covered California, I mentioned it before, but just want to make sure everyone remembers that Covered California Small Business does have the true Blue Shield full PPO network along with Health Net's full PPO network. Covered California also has a Blue Shield trio that I mentioned, and it has both Sharp HMO performance networks. I'm sorry, Sharp HMO networks. One is the Performance and one is the Premier. One's larger than the other, but CCSB has both. HealthNet, they have a wide selection of HMO networks, so you can see they're kind of the difference between them all, more of a leap behind, so you can reference later. And lastly, UHC on the network side. So one thing I want to point out on this one is if you look under UHC, the PPO networks, the third bullet point, it says the core network. What's unusual with UHC, which I think is great for out-of-state employees, if those out-of-state employees live in a state that offers both the wide or the very full Select Plus PPO and the core PPO, you can actually offer both networks to those out-of-state employees, finally giving those poor out-of-state employees a choice or more choices with plans as well as networks to help save them money. The core is in 11 different states, so we'll need to help you find out if that's an offering, but just be aware that that would be good. You could offer both the Select Plus and the core PPO to out-of-state employees, which is unique to UHC. And then a reminder, it hasn't been very popular, but the Navigate EPO, that is not available to out-of-state employees, and there's been some back and forth on that, but it's just kind of difficult, so they're just having a blanket statement, don't sell the Navigate EPO to out-of-state employees. All right, now we're changing topics to underwriting. So with Aetna, they're very flexible with startups. They only require 2 weeks of payroll versus 6 weeks, which is nice. Another big factor with Aetna is for groups 20 enrolled or more, they don't require a lot of documentation. You know, usually you need the D9C or prior care bill. Aetna actually doesn't need either for a group of 20 enrolled. They just want the master app, employee apps and waivers, and the check. So that's a nice feature. With Anthem, they're actually the best with startups because they will approve a group before the group runs their first payroll run. You'll have that group number. So if you're going to write a group for December 1st and they literally started their business, say November 30th, as long as they're filed with the state of California, we can get them up and running on 12/1 for 12/1 effective date, get them a group number. Technically, they are supposed to be able to provide 30 days of payroll within 45 days of the effective date. Knock on wood, we haven't been asked for that yet, but the group should have that up and running. Now, for all groups, you don't have to be a startup, clearly. D9Cs are not required for groups of 6+ enrolled, so they'll take the prior care bill. And what's nice with Anthem when they accept the prior care bill for these 6+ groups is they don't really nickel and dime you on, do the names match, is it the exact same number on the bill as you're enrolling. There can be some leeway there. They're not going to, go line by line and verify that all the I's are dotted and T's are crossed. So they're very flexible to work with at Anthem. On normal groups, so if a group of less than 6, you're submitting that D9C, you also have to provide that prior care bill with Anthem. No one else requires that. So just keep that in the back of your mind. All right, California Choice, they're also pretty flexible startups. They, instead of Aetna's 2 weeks, Cal Choice only requires 1 week of payroll. It has to be a group of 5 enrolled or more. The difference between Cal Choice and Anthem is the fact that Cal Choice wants to see the 1 week of payroll before they'll approve you, whereas Anthem doesn't. With California Choice, for a group of 10 or more, they don't require the DE9C. They'll take the prior carrier bill, but unlike Anthem, Cal Choice will make sure that the number of people on the bill is plus or minus 10% as the number of people enrolling. So, if you have a bill with 10 people and you're enrolling 8, that's going to be knocked out of that 10%, or we're going to have to come back and ask you for D9C. And that's actually happened a couple times, so we just want to remind people of that rule. With Covered California Small Business, they're like Aetna. They just want 2 weeks payroll, but they will want the payroll before they approve the group. With HealthNet, if you have a Southern California group and you're selling that Enhanced Care Portfolio B, there's 2 different rules based on the size group. If you have a group of 6+, they will take the prior care bill instead of the D9C. But a group of 10 or more, they're kind of like Aetna, they don't need anything. They just have a form for you to sign. You don't have to give a D9C or the prior care bill. With UHC, group of 10 eligible, not enrolled, but 10 eligible, They've had that participation certification form for a while. Larger groups, you know, they just don't want you to have to go through all this paperwork, sign the form, and they just want to get the group processed faster. Some miscellaneous underwriting with Anthem. This isn't brand new, but do want to remind folks because Anthem is back to being our #1 small group carrier again for 2018 as of April of this year, and they're having a very strong fourth quarter. With Anthem, we get groups approved in 1 day, and I know everyone can be quick when it's slow, but Anthem gave us those 1-day turnaround times a year ago when we were selling a lot of Anthem for that very busy December, and we were still getting group numbers approved in a day. When Beere&Purves submits the Anthem groups, we send it over through API fee, which doesn't cost you anything, and we get the group number and the member IDs immediately. So very pleased because we all know people just, especially if you're submitting late, you want that group number as soon as possible so people can get their care without a problem. United Healthcare, again, not new, but just a reminder, we have their underwriting down to 3 days or less. And they have been our #1 carrier for 2 years, so even with high volumes, they're able to stick with that. We'll point out the little groups with just 1 to 2 enrolling will take longer. They actually, you know, are really scrutinizing these groups and auditing them up front before they give the approval, unlike the larger groups of 3 or more where it's more just kind of processed quickly. I do want to point out, you know, you might think I'm not going to sell too much Aetna, but they're very competitive in 2019 on the HSA 6000, so your sales with Aetna might pick up because they're extremely competitive. One trick with Aetna is when you submit the business. If you're going to write a group for January 1st, we have to have a group by December 20th. So they want it by the 20th of the month prior to the request effective date. Very unusual in the industry, and they do not make exceptions to that. So just want to make sure everyone understands. Aetna, you have to submit early. Covered California, this is more of a statement for once the group is approved. We all know you get that group approved, and then we always get, oh, I want to switch plans, I want to switch carriers potentially. With Covered California, if you let us know within the first 15 days of the effective month, they will allow some changes. They will allow the member to switch plans within the carrier they initially selected on their application. But if you enrolled with the full network Blue Shield PPO plan, you couldn't come 5 days into the effective day and say, I want to switch to Kaiser or vice versa. They'll let you switch plans within Blue Shield, but not from Blue Shield to Kaiser. And I think that's been a real stickling point with them, so they wanted us to make sure everyone understands that one. All right, moving on to participation, and really the conversation is alongside Kaiser. So with Aetna, they're somewhat flexible. They require 40% alongside Kaiser, but Anthem's a little better. They'll go down to 25% for groups 5 enrolled. That's technically a promo, but it's been continuing on, I think, for about 2 years now. And individual coverage with Anthem is a valid waiver on or off of the exchange. That continues on. So Anthem alongside Kaiser for groups 5 enrolled, we've seen 25%. California choice, I think everyone knows that there is no Kaiser participation. Kaiser is one of the carriers within Cal Choice, and you can have 99 on Kaiser and 1 on the Anthem PPO with Cal Choice, and you're perfectly fine. Same thing really with Covered California Small Business. There's no participation alongside Kaiser within the portfolio. We are very excited for many reasons, but this is a big one for Covered California Small Business. We get a lot of groups where we don't have 51% of the group actually of the eligibles in California. Our only home with that has been United Healthcare, and we've written a lot of that, and it's great to have that option, but it's also nice to have a second choice as well. So Covered California Small Business, I know it's the California State Exchange, but they are not requiring 51% eligible in California. The California Exchange is going by the federal rule, and they will write a group. It does have to be a California company, and you do need 1 California enrolling employee, but if you have that, we can write a group in California on Covered California Small Business, even though the majority of the employees are outside of California. So we're thrilled to have that option because it comes up a lot. Now, with UHC, we can actually even write the whole group outside of California. It doesn't even have to be a California group at all with any enrollees here. We can write the whole thing outside of California. But with CCSB, it has to be a California group with 1 enrolling. With HealthNet, it's newer, so I'll point it out. They are now accepting individual waivers as a valid waiver. With United Healthcare, they're continuing on their most flexible Kaiser participation rule. So it looks trickier than it is. We really just need 5 enrolled in California with UHC alongside Kaiser. The 60% is there, but they count Kaiser members and UHC people as well as individual coverage, all valid towards that 60%. So the individual doesn't count against you. So between your Kaiser and your UHC, if 60% of the eligibles are enrolling one of those 2 carriers, you've met the 60%. So really just keep them back in your mind. We just need 5 enrolled in California if you're selling one of the 4 Choice Simplified portfolios. That does not apply to that special multi-state portfolio. That is stricter, and they actually want a 60% along with UHC. They don't count Kaiser members on that state portfolio. UHC, as I said, counts individual waivers as a valid waiver on or off exchange, and as I've alluded to before, we write a lot of groups where you don't have 51% in California with UHC. There are a couple states that are problem children, Nevada being one of them. We cannot help you with Nevada groups. And Colorado and Wyoming just require approval, so keep that back in your mind. Okay, switching topics now to special open window. With the special open window, just a quick reminder, we've had it for several years, but it's an odd bird, so we'll remind everyone that this is the one time a year that you can find a home for your problem participation groups. So if you submit a group between November 15th and December 15th for January 1st effective date, the carrier cannot decline the group based on participation or contribution requirements. In my opinion, no carrier ever knows really what the contribution is that the group's paying, but they do know if you're paying too low because you're not going to get the participation that they do require. In 2018, it's important to know that December 15th falls on a weekend. The carriers do not like the special open window groups, so they're not making an exception to take those groups like on the following Monday. So all of our carriers are telling us that the rule for 2018 is you must submit between November 15th and December 14th, not December 15th this year. So please remember that one. And the trick with this is we can take one employee out of a group of 100 under this rule. It's completely fine. The carrier could not decline the group if all other rules were being met, if they were truly small group, 51% eligible in California, et cetera, et cetera. But remember, we do need apps and waivers from all eligible. So you wouldn't have to give us 99 waivers for the 99 that were not taking the coverage to get that one person coverage. The special open window, we have written a lot of that, especially last year. It was really picking up some traction. So beware. When you're writing that, though, there's 2 things to keep in mind. Some carriers don't like these groups and think if you're offering Kaiser alongside that they don't have to apply this rule. And then some carriers are saying, well, we have to take you the first year, but we don't have to renew you. So here's a quick summary of what our carriers are doing. With Aetna, you cannot offer Kaiser alongside Aetna for these special open window groups, and you actually have an attestation form you have to sign. If you're not offering Kaiser, they will take you and they will renew that group year after year if they're special open window groups. Anthem is very similar. If they know you're offering Kaiser, they'll have you sign the attestation form. But if Kaiser's not in the mix, they will have to take you, and they, in their opinion, view that they will renew you. With California Choice, they don't allow Kaiser either. Kaiser is alongside or within Cal Choice, so they don't want to compete with that. And they will have the group renew, though, at normal participation levels. So you'll have to sign a letter with renewal that says you meet the normal 70%. The most unique carrier in the special open windows, the best fit, is Cover California Small Business. They will offer alongside Kaiser Direct, and they will renew the group year after year if they enrolled initially under the special open window. You won't have to meet that 70% participation that Covered California Small Business normally requires. So if you have a group, please keep in mind Covered California Small Business because they're flexible with Kaiser and they'll renew it. Health Net's fine alongside Kaiser, but they say that they have the right to cancel you at renewal if you're not meeting normal rules. With UHC, they will allow alongside Kaiser as long as you're meeting their normal Kaiser rule of those 5 employees in California on UHC, assuming it's a Choice Simplified package. One new thing with UHC, so I'll throw it out there, is they will take a group of common law, or just owners only, but you have to have one enrolled common law employee. And with some structures, sometimes the owner qualifies for a common law employee, but just keep in mind that they will still require one enrolled common law employee. So this isn't a way to get around that participation rule that they have throughout the year. And UHC says that you may not be renewed on these special open window groups if you're audited. You'd have to meet the normal rule. Another topic that comes up at this point of the year is, can we change your effective date from December to January, or a different day? And every carrier has different philosophies. For the most part, everyone says yes. Some people have different timelines. For example, Aetna, you see there is 60 days, which is pretty far in advance. One new thing with Anthem, word is in 2019, they might start requiring approval for these groups that want to change effective dates. So that's new, not for January, but possibly for February forward. Anthem might require approval to change your anniversary date, but they're not very strict on when you have to submit that. CalChoice is a little different, so I'll point it out. CalChoice will let you switch anniversary dates. However, you have to be moving to a date outside of the original quarter that they're enrolled in. So for example, a group can move from December 1st to January 1st, which is our top request, but you couldn't move from December 1st to October or November because it's in the same quarter. Also, I didn't think this was going to come up much, but it comes up a lot more than I thought it would. California Choice, you cannot move a group from Kaiser Direct to CalChoice off the original Kaiser Direct anniversary. So keep that in mind. Now, with changing effective dates, this is actually the one strict thing Covered California Small Business has. They do not allow you to change the anniversary date with an existing group. The group could cancel and reapply, but that would not be a fun process for anyone. So essentially, that's the one trick with Covered California, is you can't change your anniversary date. But be aware, the CalChoice rule I just stated about you have to be moving to CalChoice on the Kaiser Direct anniversary does not apply to CCSB. So you can move a July Kaiser group to CCSB for 12/1, and that is fine. And then you see that HealthNet and UHC also allow you to change anniversary dates, and UHC has a 30-day deadline. All right, now we're moving on to rates. With Aetna, you'll see the quarter-over-quarter rate action was very low. This is the continued trend in small business in California. Renewals continue to be low. You'll see that with Aetna, some of the renewals are actually -12 to -3% on their top selling plans that we see. Their most competitive plan in 2019, as I've already alluded to, is going to be that Managed Choice Bronze 6000 HSA plan. I've seen it 10 points plus less than the next HSA 6000 plan. So I do think you're going to start selling more Aetna for that specific plan design. With Anthem, they too have had very low quarter-over-quarter increases, 2% you'll see there. And then for renewals, you could see anywhere from a -1% to up to 12%, depending on where they are and what plan they're on. So trend continues to be low in 2019 for small group. Anthem, as I said, they are #1 medical carrier for 2018 as of April of this year, and they continue in 2019 to be competitive in rural North for the first time I've seen in like 15, 20 years. So they are finally a lot more competitive way north in California, in Contra Costa, Central Valley, and Ventura in particular. But every group's different, so see what the makeup is and what looks for your specific group. California Choice, this is a different topic. They, for the first time ever, have increased their admin fees. So you'll see a group of 1 to 8 is now, instead of $20, it's $30 per month. Remember, you do get those business suite solution programs included for that admin fee, et cetera, and the beauty of consolidating your bills and apps, et cetera, within offering multiple carriers. Covered California Small Business, however, has no admin fees. So that's a big difference between CalChoice and CCSB. CCSB continues to be very competitive in Bay Area and San Diego. And CCSB is like HealthNet and Kaiser Direct. When you have a new hire, they're going to look at the age that new hire would have been if they worked for the company at the group's last renewal and charge them that premium. All the other carriers look at that new hire's age for when they actually enroll with that company and go from there. Health Nets, again, you'll see their low quarterly rate actions, low renewals, depends on where the group is, could be a negative 12%. They're very competitive, as I said, in Southern California narrow network HMO plans. The new hire age is, as I mentioned, at the last renewal versus the age they are when they actually enroll. And UHCs come on very strong for 2019, so it'll be interesting to see who are number one carriers in 2019. They're coming on strong in the Bay Area, Fresno continued, Orange County, and San Diego. UHC is extremely competitive in 2019. Commissions, no change there. Just a reminder, if you are selling Anthem for December groups, if it's a group of 10 or more, they're going to give you 7% for December 1 groups, and that is for the life of that account, and that's a 40% increase over the 5% you see here listed for a normal effective date. One thing I want to mention with CCSB, I know some people groan when we mention that carrier because it was very painful when that carrier started in 2014. They've come a long way, and we're thrilled to have them now because they've worked out a lot of the administration and commission payment issues, et cetera, et cetera. You know, no carrier is perfect, I know that for sure, and that's what we're here to help you with. But they're much better than they used to be. In addition, just a reminder to sell CCSB, if you're not already, you do need to be certified with them. It's an extremely easy process now, unlike the original process. You don't have to sit in a classroom for 8 hours and take 2 online tests that take forever. The process now is you go online, it's 1 hour certification that you just watch, and it's mainly about HIPAA and IT security is the gist of it, which is a good reminder for all of us. There's no test, and you're done. And then you're certified by Covered California Small Business. And the nice feature is now it's so simple that everyone in the office can do it, and therefore everyone can talk about those own agency groups. There's lots of jokes within agencies we visit that there's only one certified person. Everyone pretends to be that one person when they call CCSB, and you don't have to do that anymore, which is nice. Quick reminder, since we're talking commissions, is CCSB does mail the commission statement separate from the actual check. So it does come separately. Don't think you get the statement and think the check is missing. It will come separate. But it will come now, unlike initially. The topic today was all medical. Just a quick reminder, we have all of our ancillary carriers. As you know, all the medical carriers really want to sell their ancillary. Everyone continues to be very competitive, rolling out better and better products, better in pricing. So here's all the ancillary carriers we can help sell in addition to the medical carriers that we just discussed today. Another quick topic is the advantages of small group. In 2016, small group in California went to 1-100, and those 51 to 100 groups went kicking and screaming. They didn't want anything to do with small group. However, it seems like the tide has changed a little bit. Most of those groups, whether or not they were truly 101 full-time equivalents, attested to being over 101, so they could keep those composite rates that everyone loves, certainly. However, as time has gone on, and we're seeing a lot more of these 51 to 100 groups right now in the fall, actually moving carriers finally, is the large group might not be attractive for every group. So you are what you are. If you're 101 full-time equivalents, you should be in large group. But beware those groups that said they were in large group that might not have been. The Kaiser rule, as we've seen before, is very flexible in small group. For example, with UHC, you can have 5 UHC, 95 Kaiser, and that's completely fine in the small group world. I think the average rule in large group is 50% alongside Kaiser, so it's very different. Also, the rates actually, yes, they are community rates, which are not fun, but the rates could be more attractive in small group. You know, small group cannot give higher rates based on the medical of the employees and the dependents. The medical factor doesn't hit small group at all. You can also offer multiple networks in small group without a load. Also, some large group carriers load for certain SIC codes, law firms, nonprofits. You know, some of the large group carriers don't want that. You don't get that in small group. So my message is, if you have a group that's on the border and they attested to being large group, please quote small group and look. It may or may not be more competitive than small group, but we're seeing definitely some groups are. A lot of groups are getting kicked out of large group now because you may be technically close to 100, but you don't have that many people. And so the large group carrier doesn't want to have a group of 20 people on their large group platform. They want you to go small group. So give us a call. We can help you with these groups. But definitely see more in the market that those groups are finding out that composite rights might be worth it. I talked to a friend on Saturday. She's got a group of literally 99, 100 employees. 6 people are on Blue Shield. The rest of the company is on Kaiser. They looked at both and they decided to stay in small group because the rates were going to save them $250,000 by staying in small group over moving to large group. 'Tis the season. It's fourth quarter, so a couple quick reminders because everyone is starting to submit their groups for December 1. Thank you very much. When you are submitting carrier or changing carriers, we all know it, but when you're working fast and furious, some good reminders are don't forget about those poor Cobra and Cal Cobra members that sometimes find out 90 days after the fact that their carrier was changed and they should have changed too. So remember to reach out, find out who those people are and communicate with them. As we approach December 1st, and then if you're submitting January 1st business, as you approach January 1st, please remind all members to refill prescriptions before the new effective date comes. So if it is the 2nd of the month and they haven't even turned in their paperwork in, which is our world and small group, that they can get prescriptions or they'd have a supply at home versus needing to get a prescription while they're waiting for implementation. Another quick reminder is when you're doing enrollment meetings, don't forget to mention mail order needs to be switched from the old carrier to the new. It's not a hard process, but it's just something that needs to be done. And then when the dust is settled, please take time or have the HR person take time to audit to make sure that everyone that enrolled is enrolled, that everyone's on the right plans, the right network, they had their PCP they wanted, etc. And we can help you with those changes. If you wait and find out 60 days after the fact, as you've probably experienced personally, the carriers are getting very strict on retro terms and changes. So sooner rather than later is always best. And then we all get so excited to get that group number with the new carrier, we forget sometimes to cancel the prior coverage. So just a reminder, you guys all know this stuff, but when you're working fast and furious, some things to remember. All right, so we've covered a lot of information today, and I just want to point out that we put a new feature on our website. And so if you go to our website, we have a consolidated area. Here's a link up here. It's for is a 2019 landing page where it has all the details by carrier. So you can look at that. I might pull that up in a second here as we have a couple more minutes. And brand new, we want to introduce that, we have a great partnership with eCentral, and a lot of our brokers have been using eCentral. You've probably heard that Anthem now is giving at the broker level through eCentral an API real-time connection. So if you have a group that has an eCentral that they're using for their ads, deletes, etc., and they have Anthem, that can be real-time. Just a quick reminder that when that new hire goes onto eCentral and enrolls and presses submit, that doesn't feed over the API. The broker, or better yet, you can have Beere&P do that. There is a charge for that. If you place a business through Beere&P, we will pick up that charge. So give us a call if you have any questions on that, but we're just announcing that we will support you guys on having that eCentral API real-time feed for those Anthem ongoing maintenance. All right, in summary, just a quick reminder of how we can help you. We know you're busy. We appreciate your time today. I think you'll find that when you call us, everyone at all levels is very knowledgeable. We're very professional and can make your life easier because we give you the right answer the first time while you're off doing other stuff. And we've continued to make enhancements to our quote engine. So that multi-option feature that puts multiple carriers in one column is easy to work with now because you can auto map plans and then just defaults to those, what you've selected. We've also linked to summary of benefits within the quote engine now, getting lots of compliments about that. And I'll show you a reminder that we've added a lot of documents onto our website this summer. So now we are hosting all the carriers' SBCs. A lot of their just generic brochures, not just the benefit summaries. And we've added search features onto our website so you can easily find the carrier's documents on the Beere&Purves website versus having to go into each carrier, which some are easier than others. We're always a great source for rate, benefit, network, underwriting, and legislation information. We'll always keep you posted. And on that note, if you want to be immediately notified via text. We're not going to send you a text every day. We keep it very limited to rate availability, network disruption, or key legislation updates. Those are the only topics that we would text you. However, we're more active on Twitter daily. If you're on Twitter yourself, feel free to subscribe. And we do host all our webinars, et cetera, on YouTube. So you can go there and reference stuff if you need it later. If you can't make one, you can know it's always will be hosted there later. And lastly, we just want to talk about underwriting. So not new, but you sell a group today, we can have those kits to you or the group tomorrow. We can include other carriers that we don't sell in that. If you just provide it, we'll put it all in the kits. We have enrollers for Spanish, and we actually will hire interpreters for other languages as needed. We talked about with Anthem, we have real-time feeds. You get that group number and member IDs in a day. With all the other carriers, it's a 2-3 day on medical turnaround time. And one key thing, as I talked about the formularies earlier, is you want to never be surprised, right? Please let us do the work. We always know to search for the providers when you're looking at moving in a different carrier, but don't forget to find out the prescriptions that are important to that group you're working with. Send over the list of prescriptions. We will do the heavy lifting, and we'll go ahead and look up which prescriptions are covered by which carrier, so you know which carrier is best for that group. And then we'll always do ongoing service. We get rave reviews on how hands-on we are with groups once they're placed with us. We can help the group learn how to do adds and deletes with their new carrier. We can work with exceptions. So Randy Halsey is Director of Operations at Beere&Purves, and he has great relationships with the carriers and gets a lot done. We can just do normal adds and deletes, billing, claims issues, whatever you need. You place the group through B&P, and we will always take that off your plate so you can focus on working on other items. And then 2, if you have an eSential subscription, we will also do ongoing maintenance with eSential. So what that means is if you give us access, when the email comes through on a daily basis that there's been a change in a group, we will do the heavy lifting, which is what brokers didn't like, doing it themselves, going into eSential, finding out which group had the change, what the change was within that group, pulling the apps. Then B&P will process the carrier apps that we sell and that you place through us. We don't sell Kaiser Direct, unfortunately, but we will pull that Kaiser app and email that to you to send. So you don't have to dig into eSential, find out which group, which employee, et cetera, had a change. We will do that, send it to you. We're going to have heavy communication explaining what we're working on and when it's processed and what you need to do, and we'll attach that app. Let us know if you have any questions on that. So I will check the questions real quick, but I know it's a little over our time, and so if we don't have time to get to it right now, then I will circle back. The one question I see is with Aetna, yes, if you sell a group for December 1st, we need the paperwork by November 20th. That is correct. And I think that's the only question I see at the moment. Again, we will be sending out these slides to everyone. Thank you very much for your time. I know it's a lot of information. Just let know you can always reach out to us and we can help you out. Thank you very much for attending today and for your partnership and all of your business that you place with B&P. We know you have choices and we really do appreciate it. Thank you and have a great day.